Okay, so we did the virtual cardiology lab, and our first patient that presented, his name was Alex. He was a 30-year-old male, complaining of syncope. He also had a history of having a sister that he lost due to heart disease. Upon auscultation, they found there was a systolic murmur, and then they ordered an echocardiogram, and the findings presented that his aorta had increased in size, indicating an aortic aneurysm. The MRI found that he had a dilated aorta. During the pedigree, they found that it was a dominant inheritance pattern from one parent, and there were also 2 out of the 3 children who had the same disorder going on. There was no electrocardiogram that was performed, and he was eventually diagnosed with Marfan syndrome. Our second patient that presented, his name was Bob. He was a 35-year-old male, also was a dwarf. His chief complaint was breathlessness with erratic heartbeat. Upon auscultation, the heart sound showed that the first and second sound to be abnormal. The echocardiogram found that there was a missing wall between the right and left atrium, so there was an atrial septic defect. There was no MRI performed. The pedigree findings showed that there was a recessive pattern of inheritance. None of the parents had them. One of the child had it, and then I believe there was a niece that also had it. There was no electrocardiogram performed, and it was found that he had Ellis Van Creveld syndrome. Our third and final patient, his name was Carl. He was a 55-year-old male. He presented with chief complaint of dyspnea and fainting with exertion. The auscultation found the diastolic murmur. The echocardiogram showed a mitral valve thickened, and it didn't move properly. There was no MRI. The pedigree findings showed there was no inheritance found. There was no parents who had it, nobody else in the lineage. So it wasn't inherited from anybody else, and there was no electrocardiogram found. So he was diagnosed with mitral stenosis. And that was all for the cardio lab.